We're going to talk about cancer risk assessment here at Hematology and Oncology Associates of Northeastern Pennsylvania along Mead Street in Dunmore. Joining me now is Michelle Gazzillo. Michelle, nice to talk to you today.
Nice to talk to you, Dave.
Well, tell us a little bit about cancer risk assessment. What do we mean by that?
Well, that is the patients that come to us who either have a family history or a personal history of cancer, and they're worried to see if there's something they should be doing more, whether it be genetic testing or other screening or diagnostic exams to find cancer early in themselves.
Tell us a little bit more about some of the hereditary cancer syndromes. What type are out there?
The two big hereditary cancer syndromes are hereditary breast and ovarian cancer syndrome. That's the one that gets the most hype, I guess you would say. The one that Angelina Jolie came out and said that she had. And what that is a cancer syndrome associated with breast, ovarian cancer, prostate cancer, male breast cancer, and young diagnosis, young age of diagnosis. And then their other big cancer syndrome that a lot of people don't know about is Lynch syndrome, which is associated with young colon, uterine, and ovarian cancer.
All right, so when you do one of these cancer risk assessment programs, what do you discuss with the patient?
Well, when we see the patient, we go through their family history, who had what, when, where, why, and their personal history to see what risk factors they have for cancer, to see what else we can do to decrease their risk, which means, do they need more screening with mammograms or breast MRIs, more frequent colonoscopies, and then a big chunk of what we do is genetic testing, seeing if someone is a candidate for genetic testing, if their insurance will cover it, and what we would do differently for them if they had it.
All right, so then at that point, if someone is diagnosed with cancer or maybe is determined to be high risk, what are the next steps for the patient?
So what we can do is we can actually do a blood test, or they can do a cheek swab, and they can actually send your DNA out to a company, and they can find out if you're born with an abnormal gene associated with hereditary cancer.
All right, so those are some of the possible things that you can do. What about, I know people are always concerned about costs. Is this something that insurance would cover?
Well, that's one of the big things that we determined during the cancer risk assessment. We see, if they meet the national guidelines, then most insurances will cover, and that is something we make sure that we know before we send their blood work out. And so most insurances do cover.
For our viewers that would like more information about cancer risk assessment, Michelle, where can they go?
They can call us at 570-342-3675 or talk to their family doctor. And the other thing I just want to point out is that only 10% of cancers are actually caused by hereditary, so that would be something we need to screen for.
All right, Michelle Gazzillo from here at Hematology and Oncology Associates of Northeastern Pennsylvania along Mead Street in Dunmore. Thanks so much for being on the show today.
Thank you for having me.
We are